Thank you guys so much for being here today. I am here with Commissioner of Health, Dr. Lance Fry, the Mayor of the great city of Oklahoma City, David Holt. Thank you. Thanks, Mayor. Timothy Pearson, the CEO of Integris. Keith Reed, the Deputy Commissioner of Health. Dr. Patrick Mcgough from the Oklahoma City County Health Department. Brigadier General John Harrison from the Oklahoma National Guard. And Dr. Douglas Drevitz, the Chief Infectious Disease at OU Health. So I want to start by acknowledging and thanking the healthcare workers here at Integris and across the state of Oklahoma for partnering with the state to distribute the COVID-19 vaccine. I have visited with healthcare workers across the state, and I know that they are exhausted. It's been 10 months in their fight against COVID, and I want to thank them. Hope is near. It's important that Oklahomans understand what's happening in the state of Oklahoma today. I am so grateful for Tim Pearson and all the hardworking team members here at Integris, also at the Health Department, and all of our partners across the state. Oklahoma, today is an historic day in our fight against COVID-19. This morning, we officially received the first delivery of the Pfizer COVID-19 vaccine. This morning, Operation Warp Speed delivered it to the state of Oklahoma. The FDA cleared this vaccine for emergency use late Friday night. So 72 hours later, it's here in Oklahoma and being distributed to healthcare workers on the front lines. This is a major step to get us back to normal. But I want to be very clear, we're not going to get there overnight. I want to thank all Oklahomans who are continuing to take precautions to prevent the spread of COVID-19. It's critical that we all keep up our fight. It's going to take several months to get this vaccine out to everyone, but there is light at the end of the tunnel, so we've got to keep pushing hard. My first priority has always been to protect the health and lives of Oklahomans. We're also going to keep our businesses open safely, and we're going to safely get our kids back in school. This vaccine is a big piece of this puzzle, but we still need to keep doing our part. As governor, my job is to make sure that we have the resources and support to get this vaccine to Oklahomans as quickly and as efficiently as possible. Today I'm here with veteran healthcare professionals and state and local leaders who are all part of that plan. They've been working on a detailed plan to make sure Oklahomans are covered no matter where they live in the state. I now want to turn it over to Dr. Fry to tell you a little bit more about that delivery. Dr. Fry?
Thank you, Governor. I'm so happy to be here today on this historical day to not only give you some exciting news, but also a message of hope. The day we've been waiting for is here. We're excited to be here to announce the arrival of the first doses of COVID-19 vaccine in the state of Oklahoma. This initial delivery includes 33,000 doses of the Pfizer vaccine. 7,800 of those doses arrived here at Integris, some of which will be redistributed to other healthcare facilities and regions across the state. We're using a hub and spoke model in order to distribute the vaccine throughout the state. An additional 9,750 doses arrived today at St. Francis Healthcare System in Tulsa. We believe Oklahoma could receive over 166,000 doses of the Pfizer and Moderna vaccine by the end of the month. To our healthcare workers who have been working relentlessly around the clock to keep Oklahomans safe and healthy, we cannot say thank you enough. We're so excited to help protect you against COVID-19 with this vaccine. It is exciting to have this vaccine in hand, but please remember We all have to, this is just a part of the solution. We still have to do our part. We must continue to do more to stop the spread of this virus. Distributing this vaccine is going to take some time, and it's going to be in limited quantities, but we know that we're going to have continued shipments in the future. Given the difficulties of vaccine storage and the differences between the vaccines, we're going to have to be as flexible as possible as we roll out the vaccine throughout our distribution plan. We know that Oklahomans are anxious to receive the vaccine, but please be patient. We have a plan in place, but we must get it out to our frontline healthcare workers and most at-risk people first. We will continue to be transparent about where and when we distribute the vaccine, and it is vital that Oklahomans continue to take precautions to slow the spread of COVID-19 while this vaccine is being distributed. Everyone should continue to wear a mask, wash your hands, watch your distance while you wait for the vaccine. These actions, in conjunction with the vaccine, can make a significant difference in keeping our families and communities safe and healthy in the long run. We urge you to continue to work together to protect each other from COVID-19 so that we can get together again soon. I'll now turn it over to Oklahoma City's Mayor, David Holt.
Governor, Tim, and the Integris team, our public health officials and healthcare professionals, thank you for hosting us here on this occasion. In April, when we were starting to reopen gathering places that had been closed for 6 weeks, I turned to an oft-used Churchill quote to try and communicate where I felt we were in our pandemic journey. My conclusion was that in Churchill's words, we were only at the end of the beginning. It feels like a lifetime has passed since those days in April. And today, standing near a vaccine distribution facility, I feel I can say for the first time that we have finally arrived at the beginning of the end. The images we are going to see here in Oklahoma City today will likely leave us emotional. To watch someone receive a literal shot in the arm will give each of us a metaphorical shot in the arm. The moment is historic. The effect is life-changing. All of this is true, and the moment is worthy of commemoration and gratitude. Thank you on behalf of the people of Oklahoma City to the drug companies that have exceeded all historical expectations. Thank you to the federal government for its stewardship of this process. Thank you to the state government for its preparatory work. Thank you to our indispensable Oklahoma City County Health Department. And thank you to the healthcare professionals who will do the work on the ground. But let me say this, though the day is historic, emotional, and life-changing, the concluding chapter of this journey may be one of its longest. Today begins a multi-month effort, and that effort commences in the midst of our worst wave to date. In Oklahoma City, we are currently averaging almost 1,000 cases a day, and we have been averaging about 600 COVID-19 patients in the hospital. We've been at or near these all-time highs for weeks, and they are stretching our healthcare workers to their limits. It will be months before the vaccine is distributed widely enough that it is a major contributing factor in diminishing the spread of the virus. Until then, we still have to manage these numbers on our own. As excited as I am about the arrival of this day, I am cautious and concerned about irrational exuberance. Just because you saw a nurse receive the vaccine on television does not mean that you have magically received the vaccine. Don't be the last soldier to die in the war where the peace treaty has already been signed. From this day forward, an avoidable transmission of this virus is especially senseless. You can see the light at the end of the tunnel. It is in fact the light of day, but if you relax your precautions, it will turn into a train. What you're seeing today is absolutely an encouraging glimpse of our future, but for most of us, it is not our present. So please, resolve to maintain and even enhance your precautions, recognizing that there is an end date now. The fatigue you feel will be remedied. You can do this. You have to do this. Let's get these numbers down the only way we know how today, by wearing our mask, keeping our distance, and washing our hands. And when our time comes, we'll get our 2-dose vaccine, and brighter days will arrive for all of us. Thank you again for the opportunity, and to everyone involved in the preparation of this vaccine distribution effort and its implementation. The people of Oklahoma City extend our deepest gratitude to all of you. Thank you, and it is now my pleasure to bring one of our amazing hospital administrators who have helped manage, obviously, the healthcare side of this crisis over the last year and has done so very ably, the CEO of Integris, Tim Pearson.
Thank you, Mayor. Thank you, Mayor Holt, and thank you all for being here, and thank you, Governor, and your team. You've been absolutely terrific in working towards this day for vaccinations to begin. We're about ready to see something historic. The fact that we are, as Mayor Holt said, nearing the beginning of the end of this, and we're grateful for the many professionals. I will tell you how impressive Oklahomans are in terms of our health professionals, our leaders in really diving in and solving this problem. As was mentioned, this is not the end. We still need to be vigilant. We still need to wear our masks. We still need to social distance. But we are at a point where this is an exciting day. I woke up very excited. Let me just say, for those of you in the community who know a healthcare worker, please extend your appreciation to them. They are the heroes of this pandemic. They fought for you. They continue to fight for you. They rush into the battle for all of us. And I'm very humbled and grateful to be able to acknowledge them and appreciate what they've done. So please, if you would, extend love towards a caregiver, show them that you care, express that appreciation, and more importantly, show by your actions. Be careful, be patient, wear your mask, social distance, and we'll get through this together. I'm now pleased to introduce Keith Reed, who's the Deputy Health Commissioner, and he's going to talk a little bit about logistics.
Good afternoon. I want to first thank our planning team that has worked diligently and tirelessly with state and local partners to create a plan that has made today possible. It's an honor to see their work come to fruition. Because of them, we have a plan that has been developed in close collaboration with local, state, and federal partners at CDC and Operation Warp Speed. We are excited to begin implementing the distribution of the COVID-19 vaccine to our first priority groups today. We want to remind everyone that this is a constantly changing landscape. Our distribution plan must remain very fluid, as there are many unknowns that lie ahead. We know the public wants to know when they will receive their first vaccination. We would love to be able to give every Oklahoman the day and time for their appointment, but many shifting factors must be evaluated as we make decisions on how to direct upcoming shipments. Those factors include, but are not limited to, vaccine uptake rate among the various priority groups, throughput of our clinics, which will determine the speed at which we move through our inventory, the rate at which we can shift inventory to the many pandemic providers across the state, and changing shipment details that frequently come from Operation Warp Speed. Now that the FDA has granted emergency use authorization to the Pfizer vaccine and sent the first doses to us, Oklahoma and OSDH's role is to work with hospitals, clinics, pharmacies, tribal health, and local public health entities to get the vaccine out across the state. Our most at-risk populations who will be on the front lines are included in the first phase of our vaccine distribution plan to receive this first limited batch of doses. In broad terms, Phase 1 includes long-term care residents and staff, healthcare workers providing or supporting direct inpatient COVID-19 care, public health staff conducting frontline COVID-19 pandemic mitigation, and Oklahoma State licensed EMTs and paramedics. As a reminder, long-term care residents and staff will primarily be vaccinated through the Federal Pharmacy Partner Program, which will operate concurrently to our efforts. We are in contact with Walgreens and CVS on their plans frequently. This is an example of how we are leveraging available resources to the benefit of all Oklahomans. As we receive more shipments of the vaccine, we'll proceed in providing it to Oklahomans as outlined in our priority phase plan. You can find this plan at oklahoma.gov/COVID-19. We're excited that over 166,000 first-round doses are scheduled to arrive before the end of this year. That is 166,000 Oklahomans who will be one step closer to being protected from this deadly and contagious virus. I would now like to turn it over to the Director of the Oklahoma City County Health Department to say a few words, Dr. Patrick Mcgough.
Good afternoon. Vaccine administration is a hallmark of local public health, and we are so proud to have some of the first doses of the COVID-19 vaccine here in Oklahoma County and in Oklahoma City. We have worked hand in hand with federal, state, and local officials, many of whom are represented here today, to ensure we would be ready on day one for vaccine dissemination. We have put the health and safety of Oklahomans first and worked together on a plan we are proud to help implement locally. Our public health workers have been working in the front lines throughout this pandemic, and I know they will continue to do so until every vaccine dose is administered. Going forward, this will be a community-wide approach to vaccination, including nursing schools, pharmacy students, paramedics, Medical Reserve Corps, and many, many others. I would like to thank today especially Governor Stitt, Commissioner Fry, and the hardworking staff at the State Department of Health for their coordination and collaboration in getting us to this point. I would also like to thank Tim Pearson and Integris for including us in this presentation today. I am especially thankful to Mayor David Holt for his continued support of local public health and for lending his voice to our response in such a positive way from the very beginning. I am very pleased with the Oklahoma City County Health Department staff for their preparation and commitment to ensuring Oklahoma County's vaccine campaign is organized and efficient. I will now turn it over to Brigadier General John Harrison to talk about the National Guard's role in vaccine distribution. But before I do, I want to ask Oklahoma County one more time, please wear your mask. Thank you.
Good afternoon. We have spent many months planning with the state to ensure the effective execution of our distribution plan for the COVID-19 response. We're ready to begin safely and securely delivering the vaccine to predetermined areas across the state so that all Oklahomans in our Phase 1 group will have access to the COVID-19 vaccine should they choose to take it. The vaccine will be stored in secure locations across the state, and security of this vaccine is something that we don't take lightly. The Pfizer vaccine presents unique challenges in distribution and storage as it needs to be kept at ultra-cold temperatures. Our team has worked diligently to ensure the super cold vaccine can be shipped across the state, including rural areas. In addition to thorough planning, we have had partners donate ample storage equipment that allows us to facilitate statewide distribution. Through these generous donations, areas that may not have had much available storage space for the vaccine can now easily store the ultra-cold Pfizer vaccine in their facilities. We're looking forward to continuing this collaboration with the state to safely distribute this vaccine to all Oklahomans. And again, I'd like to reiterate, as we move through this process, we haven't quite gotten to the end, so please keep your COVID-19 precautions intact as we move through this process. I will now turn it over to Dr. Drevitz with the OU Medicine to discuss this vaccine's safety.
Good afternoon. A little over a year ago, on December 1st in 2019, in Wuhan, China, a gentleman entered the hospital with a viral pneumonia. He was the first case of a disease that we now know as COVID-19. The virus and its genetic code were identified the next month. Now, today, in Oklahoma, we are receiving the first shipments and administering them of a safe and effective vaccine. Along with many other medical professionals, scientists, and federal regulatory bodies that oversee vaccine development, I am very confident that this vaccine is both safe and effective. The FDA has rigorous scientific and regulatory processes in place that ensure the safety, effectiveness, and quality of all vaccines in the United States. All of these processes and safeguards were applied to this COVID-19 vaccine. It went through the usual FDA-required assessments and regulatory processes to qualify for emergency use authorization. This vaccine is as safe as any other vaccine the FDA has approved. Though it was developed and authorized quickly, no corners were cut. Key scientific advances in genetics and sequencing had already occurred. Many scientists and manufacturing companies around the world were already studying and making RNA vaccines for other conditions. Perhaps the biggest move that brought the vaccine from clinical trials to rapid distribution were made by the federal government's Operation Warp Speed that allowed manufacturers to scale up production before the large clinical studies that were begun this summer were actually completed. The typical process would have been to wait until they received authorization and then scale up. As we can see, that would have been unacceptable. Today, the Pfizer vaccine arrived, and on Thursday, the Moderna vaccine is being reviewed by the FDA. Both vaccines are highly effective at preventing symptomatic COVID-19, on the order of 95% effective. Oklahomans should feel confident that receiving either vaccine will help them when it becomes available to them. Serious side effects for these vaccines were quite uncommon, and no life-threatening side effects were seen in the clinical trials, which were comprised of tens of thousands of people. Nevertheless, more than half the folks taking the vaccines had some pain at the injection site, felt tired, and had a mild to moderate headache. However, less than half of all individuals who received the vaccine, the Pfizer vaccine, took any medication to make them feel better or to reduce fever. These side effects are similar in frequency and severity as other FDA-approved vaccines used in the United States. We encourage all Oklahomans to take the vaccine when it becomes available to them. The State Health Department and all of your providers are pouring through the documents provided by the Centers for Disease Control and the FDA. There are some individuals who should not take the vaccine. Those are folks who have had a serious allergic reaction to components of the vaccine, or if they have a serious allergic reaction to the first one, should not take the second one. Nevertheless, we anticipate that these will be uncommon. We need to remember that the initial stages of vaccination will protect individuals, those who receive it, but it will take several months and many more vaccination phases to see the beneficial effects on public health. And now I will turn it over to Governor Stitt.
Thank you, Dr. Drevitz. And thank you all for being here today. Appreciate the media for being here, getting this word out. But most importantly, I want to thank our healthcare workers all across the state of Oklahoma, here at Integris, for all of their hard work. On behalf of Oklahomans, thank you, thank you. These men and women have really been on the front lines for months. And I just want Oklahomans to know that their shifts are long, they're tough, they've been battling both physically and mentally, fighting for all of Oklahomans and the patients that they take care of. And I know they're not going to stop taking care of Oklahomans. At the same time, we can't stop doing our part to slow the spread. Today is a major milestone in our fight against COVID-19. But we still know there's going to be difficult days ahead. Remember, it's going to take several months for us to get this vaccination out across the entire state of Oklahoma. I hope the vaccine arriving today shows us there is light at the end of the tunnel, and we are going to get through this together. So thank you so much, and we'll open it up for a few questions from the media for our panel here.
I've got a question for a medical professional. In hospitals like this all over the state, there are people on ventilators and stuff like that. Does it benefit them at all to get the vaccine now under that?
Dr. Drummond.
I can ask it again, I'm sorry.
Please repeat your question.
Yeah. So in hospitals like this across the state, there's people on ventilators, you know, the critically sick. Should they get the vaccine at their critical stage, or does that complicate things, or is there no use to it?
That's a great question. So if somebody already has COVID-19 and are sick from that, the vaccine does not help ameliorate that illness at this point, so they would not need it. Secondly, many folks who are critically ill aren't going to respond well to a vaccine, and so you would not predict a good response. Lastly, it's been shown that really the best way to protect the people who are critically ill is to protect the people who work for them, in a sense, the hospital workers. And so that's why we've developed this plan.
Governor Stitt, we've seen different groups and organizations try and lobby to have their employees and workers kind of jump ahead and get the vaccine before the general public. Is that something they're pitching to you? Do you review that? And are you considering moving anyone up from any organizations or groups up the line?
So we put together a panel that kind of studied the prioritization of who gets the vaccinations first, and so we're going to stick with that panel. I can let Dr. Fry give you an update on that. We are looking at our K through 12 teachers to move them up the list. Later on this week, we should have a press conference regarding guidance for schools coming up next semester.
Governor, I think the last time we had a press conference of this size was right after that first canceled Thunder game in the Blue Room. How does it feel to be standing here today? We're all gathered here again, and we actually have some good news to announce. How does that feel, and how do you hope Oklahomans react to this news?
You know, I want Oklahomans to know that it's been a long, hard road. I mean, all the people up here in our team, and I'm looking at a lot of them in the back of the room here, we've literally been on COVID updates every single day since March, and so we've been exhausted by it. We're doing everything we can to protect Oklahomans. I know Oklahomans have some fatigue around COVID. Our healthcare workers, they've been in the trenches. If we think we're tired of it, think about the ICU nurses and our ER docs and all the folks that have been battling every single day for the last 10 months. So we're all very optimistic right now. Our team is very pleased that we have these vaccinations now in the state of Oklahoma, and literally right after we finish this press conference, the first 10 people in Oklahoma are going to receive, and their ER nurses and their doctors, their healthcare professionals on the front line. So we're very optimistic. We feel like that it's the start to beginning to get back to normal, and so that's what we're very optimistic about. I hope Oklahomans can see the hope and the light at the end of the tunnel, because that's certainly what this team before you feels. And so but we can't take our foot off the gas. That's kind of the message right now, is that we still need to follow the 3 W's. We still need to take precautions, because we're not out of the woodwork yet. It's going to take several months, And so everybody knows the vaccination it's 2 doses, 21 or 28 days apart. And so there are some effects in the first vaccination, but we certainly need to remind everybody they've got to get both of them.
There are a lot of Oklahomans who are still skeptical about the safety of the vaccine. I know you guys got up there and talked about it, but how are you going to convince these people? I mean, is it only going to be months of data that's going to be studies?
Yeah, I'll let Dr. Drevitz, but that's why we're here, and we're appreciative of the media also getting the word out of the that this is going to help. This is going to help, and I'll let Dr. Drevitz kind of give you the scientific part of that.
Thank you for asking that question. That's a tough nut to crack. My job as a healthcare professional, as an infectious diseases specialist, also as a husband and a father and a soon-to-be grandfather for the first time, is to give people the best advice that I can give them, including how I would treat my family. The data that I have looked at, I looked through the clinical trial protocol, I looked through the FDA documents, I have listened to hours of testimony, I listened to a podcast by Dr. Fauci this morning about this same issue. These vaccines are as safe as any other vaccine we've put out, or that has been put out. Are they effective? They look to be more effective than most vaccines that we have, which is a wonderful thing. Are they necessary? Absolutely. When people ask me, how badly should we want to take the vaccine, my question is always back, how badly do you want to get back to what you remember as a normal life? It doesn't take too many times walking through the intensive care units of our hospital, of this hospital, to see that they are indeed filled up with people laying on their bellies on a ventilator, and they've been that way for a week, maybe 2 weeks, and they may not leave. And one of the terrible things about this disease is people don't just die, often they die alone. For these reasons and many, many others, I think this was an absolutely wonderful time to take a vaccine. If somebody doesn't want it, please don't stand in the way of somebody else who needs it.
I guess I'm delaying this. The only other one I have for the governor was you announced new restrictions last week and an executive order. When will that get filed, and when will those go into effect?
That executive order will drop today. We just, our council's working on that right now. We just saw a draft.
Quick question, just about, when I get this thing, obviously people don't want to travel away, am I gonna get like a proof of purchase or a receipt or something that I can show that I'm vaccinated?
Did you say proof of purchase?
Proof of poking?
There is a little card. Let me let them tell you about it.
Well, the short answer is yes. Yeah, there's something that they're going to give you, and it'll also tell you when your next dose is needed as well.
Commissioner Fry, or maybe Keith Reed, obviously we're at Integrity today, people here are going to get vaccinated, some folks at St. Francis and Tulsa. Can you give us any more details about which locations specifically throughout the state will receive vaccines this week?
We're in respect for their privacy, we're not announcing where it's going until it actually gets there. We didn't announce until we actually saw that it physically was here before we announced that it was going to be here today and had everyone here, because there's just so many logistical factors that can go into it, and things change constantly. So we will be keeping you up to date as soon as we hear. We will get you that information.
Mr. Pearson, as far as who's getting the vaccine today, how does y'all break that down? How do you get them a roster? Is everyone that deals with COVID patients getting the vaccine during Integrity today? How did you guys work out?
No, we have 10 individuals that are frontline caregivers. That's physicians, nurses, respiratory therapists, techs, environmental services workers. So these 10 individuals, we asked who was interested, and those who were interested came forward, and we've selected them for today. There's quite a bit of paperwork and processing that we have to go through. So this is a great actual trial run for us to see how we do on the paperwork side of things. And then tomorrow, in earnest, we'll start vaccinating any caregiver who wishes to receive it. And it's based on that tiering, a very similar tiering system that the state has. We've got slight deviations, but largely pretty much in line with those guidelines. Again, that's frontline caregivers who are dealing with the patients most directly first, and then we just work our way down the list.